Well, it makes you feel like you're not out there all on your own, and that what you're going through is no different to what everybody else is going through. And yeah, no, it's been excellent.
They garnish it with some flowers.
You're living in the environment and it's so healthy. It's been life-changing.
Inside this cottage in Horsley, New South Wales, Debbie and Penny are learning how to cope, where to get help, and importantly, how to enjoy life again whilst living with or caring for a loved one with dementia.
Staying at Home program is a carer wellbeing and respite program where we work really intensively with carers of people living with dementia to provide all sorts of supports around managing physical, social, psychological, and emotional changes associated with dementia, how to navigate the community sector and community supports, and introducing that idea and that concept of respite to the carer.
Since 2016, Dementia Support Australia has provided 24/7 specialist advice 365 days a year at no cost to carers and care homes. It brings together a range of Australian government-funded programs, and to date, 93% of Australian care homes have reached out to DSA for guidance.
Our services in Dementia Support Australia really focus on when behaviour impacts care. And so what that means is that there's a risk to the person living with dementia or the care network around them.
And for people living with dementia, that care network ranges from professional aged care services to community care, family members and frequently partners.
Post the Royal Commission into Aged Care and Quality, there were lots of discussions about how we improve carer education and access to respite. And so with funding from the Australian Government, Department of Health and Aged Care, the new Staying at Home program has been born.
The 3-day residential or 1-day programs have all the comforts of home, with dementia and engagement consultants sharing the knowledge gained through decades of research and client care. It's a welcome support and respite for carers who might otherwise struggle to cope. Currently, there are 1.6 million Australians caring for people living with dementia in this country. That's family, friends and paid carers. And with the incidence of dementia set to increase dramatically, that's going to put an incredible strain on both individuals and the health services sector.
I think we need to take it very seriously. By 2030, there should be a minimum of 450,000 people living with dementia. That's a lot of people to provide care for. And every family will be impacted at some stage by someone living with dementia.
So the emphasis here is on the home, with everyday cooking and domestic activities, and design principles that make life easier for those living with dementia.
There's definitely research evidence into dementia design principles that tells us that domestic and familiar provides better outcomes for people living with dementia, reduces anxiety, agitation and aggression.
And those design principles are important for outdoor areas as well.
So it's really important in an outdoor space to have a no-fail pathway. And what that means is you exit one door and the pathway leads you back into the house. So you don't get lost. You're not out there wondering, which door did I come from?
These are simple yet important principles for residential aged care providers, community care providers and carers living at home.
Part of the program, Staying at Home, is to work with care providers and services all around Australia. So we're looking to work in partnership and have their clients access our services so when they need more services, they know where to find them.
It has lessened his stress. I've come back at each meal time and he has a smile on his face. So he's obviously enjoyed the activities, which is difficult for me to provide at home on my own.
The support network that will follow through from this, people that you can ring and if you need help or just, as they said, just to vent to somebody when life gets too hard.
What we hope with the Staying at Home program is that carers can avoid unnecessary or early entry to residential aged care or acute care settings. So by being better resourced to understand what the options are and what supports there are to them, they have more choice. That avoids the crisis, and crisis costs the health sector money.